Hello there, my name is Dr. Brownhilda Santo. Today we get an interesting, maybe controversial, but yet very educative topic. So do performance enhancement medications cause cardiac arrest? In other words, some medication the way people they take them for enhance their sexual experience. If it cause person the heart for stop. So today's topic now for mature audience. And I want to talk say when it concerns our health, no topic no going for be off limit or taboo, because remember, knowledge is power and health is wealth. Some people then feel on hear about somebody way take a performance enhancement medication like Sildenafil, with the brand name na Viagra, or Tadalafil, with the brand name na Cialis, or similar medication them. And then the year say that person faint or he get a cardiac arrest, a heart stop. And they start to say that medication this so it don't kill that person. It don't cause cardiac arrest or a heart don't stop because of that medication. Now really true say this medication they cause cardiac arrest, we'll find out for the video. So most start by even talking about why this medication they even be taken and why even some doctors they prescribe them for their patient them. They use this medication for erectile dysfunction. They feel use the medication into for some other diseases in a way I no go talk them a bit beyond the scope of this video. So most start by defining or describing what will even be erectile dysfunction. Now when a man not be able for get erection or for sustain erection and long enough for get sexual intercourse. It is so this erectile dysfunction it be more common than people they think. 1 in 4 men below the age of 40 years it go experience this erectile dysfunction at some point in the life. Now, what will be some of the things that way if you make a person you get erectile dysfunction? Number 1, if it be a psychological reason. For instance, if you get stress, where maybe it be from work-related stress, financial stress, stress for relationship, anxiety, depression, some of these things them if you make a way person you go get erectile dysfunction. Certain medical conditions if it cause erectile dysfunction. Example, diabetes, high blood pressure, low testosterone level, obesity, especially if person really big. Certain medications then too they cause erectile dysfunction. Example, na your blood pressure medication them. Example, metoprolol, atenolol, tamsulosin, when are also medication they use them for enlarged prostate problem. Doxazosin, some antidepressant and depression medication and too cause erectile dysfunction, and many other medications them. Certain lifestyle them too cause them. Example, if you did drink alcohol a lot, if you did smoke cigarettes, or if you use other illicit or street drugs them. So now, more talk about how this medication they work. So this Sildenafil, when example na Viagra, and Tadalafil, when example na Cialis, and you get this same medication, generic name them all over the world, just different brand names. And other medications, the way they fall under a class of medication called phosphodiesterase 5 inhibitors. This medication and this so they work through different mechanisms them. And the end point I say it go cause vasodilation. So it go cause relaxation for the walls and for vessel. So it go make them be dilate. And that can happen anywhere for your body. Vessel, the way that they supply different parts for your body, different organs, including the penis. And so when you get increased supply of blood to the penis, then this go lead now to erection. In fact, the way erection dey happen, when psychologically you be stimulated through different mechanisms, the way they involve hormones, nerves, it lead to increased blood supply by vasodilation to the penis, and it cause erection. So these medications, they help with that. Now, we will talk about some side effects then from this medication then. We will talk about minor side effects and major or more serious side effects. So this medication so remember, I talk say it help for vasodilate. So by doing so, it means you get blood flow for different parts, increased blood flow. If you get headache, if you get nasal congestion, if you cause nausea, if you cause upset stomach, if you cause some people for feel dizzy, if it cause people for flush. So when for people they light, if you see them easily because their face go just turn pink or a little bit red. Some people will get difficulties for differentiate blue from green color. Some people will complain of muscle ache. More talk about some major or serious side effect them. One of them now priapism, when a condition where it happen when you continue to get erection, especially beyond 4 hours. And the longer the duration of the erection, the higher the chances say if you get damage to the tissues of the penis. And in fact, in about 90% of people, the way they get erection for more than 24 hours, these people go develop permanent damage to the penis, and if it cause them permanent erectile dysfunction. If that kind of thing happen, go for hospital. What will be the other side effect? Remember, I talk say this medication it cause vasodilation. By causing vasodilation, it will cause your blood pressure. If it cause blood pressure for drop, if some people that they take particular medication, especially people that get heart problems, they feed they on a medication they call and say nitroglycerin, where the medication where the doctor will tell you say maybe put it under your tongue when you get chest pain, or other medication the way they call them isosorbide mononitrate or isosorbide dinitrate, and they call these names then because say maybe when they on these medications then. These medications now mostly people that they get heart condition that they take them. Some street enhancers and street drugs or medication enhancers and they way they call and say poppers. And this medication or these street drugs they get nitrates for them. So all these medication that I just mentioned and so they also cause vasodilation, and if you make your blood pressure drop. So if you take Viagra or Cialis or one of these medication within 24 hours of taking this other medication that I just mentioned your blood pressure will drop a lot. And what will happen if you drop? If you even faint, if you pass out. And if your heart weak or you already get some underlying heart problem, if it even cause you forget cardiac arrest for your heart to stop. And if some person collapse, check for see if the person they breathe or if you get pulse. And if you not get a pulse or they breathe, call for help and start CPR immediately. Not time this for feel ashamed or be embarrassed, because you know what, if you know help for save this person, the person will still die and people will still know which way it happened. So it be very important for start CPR immediately and call for help, because as time dey pass, where that person it heart don't stop, now so it brain cells that they die and other parts for your body also it get injury from lack of oxygen and nutrients. So what will be the take-home message today? That question will be asking whether Viagra or Cialis or similar medications that they cause cardiac arrest. The answer is no, they cause cardiac arrest. But when you mix them with other medications like I mentioned earlier, where if it cause vasodilation, then you get the risk or the higher potential for your blood pressure for drop and for get cardiac arrest. The other take-home message na say wetin, erectile dysfunction, them na taboo. Just like you fit treat high blood pressure, diabetes, this condition too need treatment. We no get for look at person where you get and let's say na weak person. No, it don't make you be weak. Na just another clinical condition where you get for understand them and you get for take the right treatment. The important thing na say you want also be safe when you take any treatment. So consult with your doctor or the medical practitioner where you feel comfortable with, and then get the help where you need them. Also, when person collapse or get cardiac arrest, them na witchcraft. I don't just explain for now how that feel happen. Na reality. So we need to take all precautions them for avoid them. And if it happen, we also need to take the right decisions them for help that person. Una share this video with una families and friends, una church group, una ex-student association, una njangi house them, so that at least whenever I post any new content, you go get notification, and also for promote the channel. Thank you very much. Knowledge is power, and health is wealth. Dr. Brownhilda Santo.